Hi, my name is Rob Gordon, and this video is to provide feedback to the Patient Experience Coordinator at UC San Diego Health and to Dr. Ina Blackman. And specifically, I need to go over some errors that were made in my medical records. Uh, Dr. Blackman, please don't panic. There's nothing in this video that will ruin your weekend. I promise you that. In fact, I think you did a lot of things right with what you did. I was looking for minimalistic healthcare. You provided that. You were fairly efficient. But there are a few errors in some critical errors I need to go over with and I need to correct. And just as significant, anyone reading this report would have a completely different idea of who I am and what's going on with my health at this particular moment in time. So for that reason, I've decided to respond by video, even though there's a very good chance I will lose my healthcare as a result. So let's just jump right in here. This is from the UC San Diego Health Patient Portal. These are my progress notes. They were written on July 17th, 2023. It appears that Dr. Leslie Martin has written quite a bit up here, but let's go down to where Dr. Blackman's report starts. Dr. Blackman, you seem to have undergone a name change. I'm going to continue to call you by Dr. Blackman if that's okay, just partly so I don't have to learn new pronunciations. I'm lazy, I know. This first part seems to be some just disclaimer information. That's all fine. This is fine. But then right off the bat, Robert Gordon is a 69-year-old male with PMH. I had to learn that means previous medical history. GAD, which I believe means general anxiety disorder, which I do not have. Depression, which I also do not have. ADHD, which I do have, and who is attending a virtual-based visit to establish care and request a referral to a psychiatrist. That is correct. The GAD and depression were initially, listed as possibilities by my actual psychiatrist, Dr. Edward Urbe, but he discarded that and came up with the true recommendation, which is I do have ADHD. And there might have been a psychiatrist I went to for an evaluation at Family Healthcare Centers of San Diego many years ago, about a 20-minute meeting, and everybody gets depression. That's just their standard diagnosis, no matter what. Even then, I was arguing against it, even though I didn't really know what ADHD was at the time. I knew it wasn't depression, so that's just inaccurate. I don't know how else to describe that. And there seems to be no way to get rid of it, by the way. This stuff follows you around for life. Patient prevents via video today. However, due to a failure to connect to patient's video, visit was converted to a telephone encounter. That's partly correct, but and Dr. Blackman, I do understand how you emphasized the video was important, but the technology failure was not on my end. It was on your end, and that was verified by your technical support people. History: the patient was previously on a combination of Adderall and Ritalin simultaneously. He reports the symptoms were well controlled with stimulants. He was previously under the care of Dr. Edward Urbe at Family Health Centers. He reports that Dr. Urbe suddenly disappeared from Family Medical Centers and that his access to care and medical medications was interrupted thereafter. He reports ongoing challenges accessing mental health care, including conflicts with medical staff and difficulties related to a legal dispute with a psychiatry provider. Reports many days of thoughts racing through his mind when he cannot sleep. That is mostly accurate, but there's one thing that does concern me in this paragraph. Conflicts with medical staff. I had no conflicts with medical staff, including at Family Healthcare Centers of San Diego. My doctor there was actually a physician's assistant. His name was Patrick Fink. He was a pretty good guy. I saw him for a number of years. All this came from the psychiatry department. I lost my medical health there because of the dishonesty, profound dishonesty of some psychiatrists there who I have never met in person and who I did not consent to treatment by. Moving on, used to work as a contract project manager, that is correct. Studied project administration at USD. That's not correct. I don't know where that came from. I never said USD. I've only, even though it's right near me, I'd only been there recently, for the first time in my life, recently for an economic development meeting. I have an undergraduate degree in microbiology and public health from Michigan State University, a graduate degree in public administration from San Diego State University, and the only training I've formally had in project management, I do have a technology project management from UC Santa Cruz. I have their certificate program. I got that when I was briefly a program manager in Silicon Valley at the end of the .com boom, and they paid for it, and I got it that way. Dr. Urbe, by the way, we know a little bit more about his disappearance there. Not very much yet. I think other people do know the story. He stormed out of a meeting there, apparently, when a bunch of the other psychiatrists ganged up on him. I fell into their politics, some really dirty politics they had there. And I don't blame him for storming out of that meeting one bit. He worked with some of the most profoundly dishonest people I've ever met in my life. So they're now claiming they fired him, but they're untruthful about everything there. And I'm sure they're untruthful about that too. Some family there has two sisters in the area who's not close. I'm talking to them more. Patient states he does not have clinical anxiety or depression. I don't think I do. I know everybody in the psychiatric profession is convinced I do. PHQ score of 11. Those tests they don't work on me. Every question seems wrong. 2014 cardiac stenting, that's correct. Stop taking ASA, I don't know what that is. Not currently taking any medications for CAD after achieving 60-pound weight loss. Yeah, I gradually stopped taking all my medications, kind of heart medications one by one. And I was under the medical care of Dr. Fink at the time. And it was just sort of, oh, you stopped taking that? Okay, you can cross it. I don't think I needed any of the ones that were given to me. I think I'm okay as far as that's concerned. I don't know what some of this stuff means. Previously taking tamsulosin, Flomax, yes, and thank you for renewing that prescription. And I do want to recognize that when I said I couldn't afford it, you did go above and beyond the call of duty and look up some coupons on your own time. I do appreciate that. I am getting it now. It is helpful, so thank you. ROS limited to patient wishing to focus only on ADH treatment history today. I'm not sure what ROS means, but that probably is accurate. Medical medications, smoking status, marital status, single, smoking status, never. I did used to smoke. Smokeless tobacco, yes. I have started that, probably subsequent to this meeting, but I am using that as a substitute for ADHD medications. And nicotine is one of the few things known to actually work. Alcohol use very rarely. Sexual activity, unfortunately, no. Family history of cancer. Rob is a 69-year-old male with PMH, GAD depression. Again, I do not know. Sue, failure to connect patient's video visit was, I'm not sure what Sue means, probably through failure to connect. That's correct, so we did talk on the telephone. Need for psychiatrist. Patient was previously on a combination of Adderall and Ritalin simultaneously. Patients reports difficulty establishing care, with another psychiatrist. Reports many days of thoughts racing through his mind when he cannot sleep. That is correct. Urgent psychiatry referral placed. You did, and thank you for that. I know you said stent, excuse me. Okay, I'm never going to get away from depression and anxiety. That's just... Currently has online store selling used watches on eBay. Has exhausted novel aspects of job, now losing interest, which he explains as a feature of ADHD. That's mostly true, but there's a little more nuance to it than that. The novel aspects are setting up the business itself, all the organization, and then the routine aspects are actually doing these listings. And they are cognitively quite difficult to do. Look, unfortunately, it's probably the wrong business for me because every item is different. So you have to have new ad copy for every single one. So that's been difficult. And without the medications, my productivity had just fallen down. When I first contacted you, I was having so much trouble that I was actually getting overdraft fees, and they would be, and then I'd make a sale, and the overdraft fees were more than the sale for something I would sell. Through some miracle, that situation has turned itself around, even though I'm working, not getting nearly enough done. But once you have a bunch of items, they can sell without you doing anything. That was happening. A bunch of sales came in. But yeah, that's been a real challenge. And I do have inventory, but I just have to do the boring routine work, cognitively difficult though, of listing watches and collector's knives and eventually technology items, personal technology items. But at the moment, that has been a huge challenge. So Dr. Blackman, in spite of those few things, your report is mostly accurate. It's well written, it's honest, and you did what I requested. You got the request into the psychiatry department and you put STET on it, asking them to do it quickly. They didn't, but you did request that. And you got me some medications I needed, and thank you, that did help. And then again, you also, even on your own time, tried to get me a discount on those medications, which I couldn't afford at the time. So I thank you for that as well. And also, probably the most important, you didn't waste my time. You didn't send me on some wild goose chases just for whatever, administrative reasons you might need. So, that's what I needed. The psychiatric, the mental health issues, they dwarf any medical issues I have right now. They're simply much more serious, and I'll tell you in just a bit there. In just a bit, they are affecting my medical health in very, very serious ways. However, I want to go over the rest of this report from Dr. Martin, Leslie Marie Martin. Now, she came on with the camera not working, and that must have been, I want to say, that must have been a little creepy for her. The body language was very defensive, and probably whatever you told her when you ran to meet her and told her to come to camera was probably upsetting and probably concerning. But I am concerned about a few things she wrote here, and again, it might be a little bit like a game of telephone where one person says something. But so let's go over that. Most of this top part seems accurate. Psych, poor historian. I'm saying I'm a poor historian. I don't know what that means exactly. Requesting Adderall prescription. I don't think I ever directly requested an Adderall prescription. That wasn't the prescription I had, first of all. I did have a combination of Ritalin and Adderall. I may have described what I had, but I did not directly request it. I don't know if that's kind of a nuanced thing. Cannot remember last psychiatrist's names. His name was Valentin Icescu. He was in Oceanside, as you've said here. And I saw him, I believe, for 8 months. It might have been more than that. It was a 50-mile drive one way for me. And I left when he went on vacation for Christmas vacation and did not renew my medications before he left. And when he came back, he did renew them again, but I had a small buffer, didn't renew that. That kind of created a dispute because you do not have a just-in-time management system. Things go wrong all the time with medication. So that was disturbing to me, and that in the combination of the drive, I did stop going with him. But again, his name was Valentin Icescu. He states one of his previous psychiatrists was a liar. That is not true. I never said that. I did use the term liar, and in fact, I might have used the term pathological liar, but I was very, very careful not to say this person was a past psychiatrist, because he was not. I had a 10-minute online meeting with this person, and it was non-consensual. I actually put in writing that this meeting is only to discuss continuity of care. It is not a session or a treatment or anything like that. Didn't make any difference. This person fraudulently claimed to have been my psychiatrist. He was not. But I think there's almost a cognitive bias, undiscovered cognitive bias, where if you say anything about a psychiatrist, people are going to assume that was your psychiatrist. So if some psychiatrist just defrauded you in a financial transaction, stole $20,000 or something like that, people would repeat it and say, his psychiatrist stole $20,000 from him. The person who did this was not my psychiatrist, was never my psychiatrist, but it keeps getting repeated in the records. It's like kind of permanent now. So that needs to be corrected. That is the most serious error here. SY is baiting him, and I want to reiterate that there has been significant false documentation in his medical chart. I don't recall saying that you were baiting me or Dr. Martin was baiting me. I don't deny I might have said something like that, especially if there was a claim, again, that, this person had been my psychiatrist, because he wasn't. And if I might have said something like, if you're saying he's my psychiatrist, that's baiting. I will take your word for it. I don't think you made it up or anything like that, but there was some nuance on that's not included here. And I want to reiterate that there has been significant false documentation in his medical chart. That's absolutely true. And at least two different ways. One, there should never have been, from this person, I'm not going to say his name in this video, apparently he's a professor at UCSD now. One, he shouldn't have made the entry in the first place. That is why this whole thing happened, because I banned him from using my medical records, and in retaliation, he wrote a huge paragraph about how horrible I am and what a drug addict I am and all sorts of other things. That should never have been there in the first place. And the second place, somebody tweaked around with the dates. I think it might be somebody who may be related to him, who is now the director of psychiatry. And if you look at the records, it looks like I had perfect uninterrupted care, and I just went off and started making threats. There was alteration to my medical records at Family Healthcare Center of San Diego. Patients returning a referral to psych, which I think is appropriate. Referral place, thank you. Health maintenance, recent labs. We just discussed labs would be helpful to ensure no other online DXs. I don't know what that means, but I agree. Patient also appears to be overdue for multiple vaccination, which patient declines as well today. That's true, and there might be some I want and some I don't want. States that he has had a colonoscopy in the past. I have. We have no documentation of this. I'll try to, assuming I still have official medical care after that, which is probably unlikely, I will get that information to you. Referral place. We encourage patient to present in clinic so he can perform a routine physical evaluation. That's fine, and I agree. I would like to someday get back to traditional medical care, but again, right now, the psychiatric issues, the trauma from being victimized by people in that profession is very, very serious, what's going on in my life. And yeah, that is an issue, and it does, I'll tell you in a bit, it does affect my health, or it has affected my health quite a bit. Per chart, patient says primary focus today is referral to psych. That's true. We can discuss this at next visit. COVID, Moderino vaccine, fine. Okay, he agrees with a residence plan. The most important thing I want to clear up is about that thing about one of my psychiatrists, never my psychiatrist. I have to say that repeatedly every time, and it still comes back on. He had to speak with his psychiatrist. they were never my psychiatrist. There has to be some way to communicate that I'm not doing. So Dr. Martin, if I offended you in some way, I do apologize, but everything I said was honest and accurate. So with those inaccuracies being reported and that feedback being provided, I would like to give you a little bit of an update on what's going on with my actual physical health, because what has gone on with the psychiatric system the bad players in the psychiatric system has been one of the biggest disasters of my life and has created an almost unbelievable amount of work for me, uncompensated work, and it seems to be multiplying, not going away. And this is just one more example of it, but I have to do it. So I want to mention first that I am self-medicating legally with legal substances. I am a member, or I'm actually the founder of, I was a founder of a group called Support Group for Adults with ADHD. It's called Hey Look a Squirrel. We had about 40 members, and I recently merged with a much larger group, 500 members, or actually took it over, the group ADHD in San Diego. It's a meetup group. I'll bring that up here. We had our first meeting last month, and we're going to have another next month. But I did meet a few people at this meeting. We met at Old Town Saloon over drinks and games of pool. I met a few people who talked about nootropics and other substances. I hate the word substances. Substances for treating ADHD. I've been trying as many of them as I possibly can. They're very hard to manage. But I'm trying, and some of them work, but then they'll kick in late. Some of them work too well, some of them don't work at all. It's been a real mess, and as I mentioned, I have started vaping. I didn't really want to. I don't want to get addicted to anything, and that stuff's really easy to get addicted to, but that is the only thing that actually works, not nearly as well. People who are actually have ADHD and are actually treated, they don't use other substances, or not as much. And that's well recorded, but we're considered drug addicts. I think everybody that has ADHD knows that. If you have ADHD and you've been medicated for ADHD and it works, as it did with me, extremely well, and you ask for the same treatment, you're considered a drug addict in your system. I mean, it might not be overtly stated all the time, but it's unmistakable. And almost everybody I've talked to with ADHD has said the same thing. I'm half surprised that my request for Flomax, you guys didn't call it drug-seeking behavior or something like that, because that's what probably would have happened in your psychiatry department. So there is a huge overlap between physical health and mental health. I think you probably know that, but it's pretty extreme with me. Let me tell you what happened the other day, the day before yesterday, just to kind of drive that point home. I find some of the material that I've had to go over to form a response to some of the accusations that have been made against me to be highly triggering, especially when I'm talked about in the third person and it's not honest, as Dr. Bishop's report about me was. So I was writing my Freedom of Information, I was writing a letter actually to your general counsel because my actual Freedom of Information request was treated as something different. So I was writing your general counsel to put in an official, it's called the California Records Request Act. It's my legal right. While I was reading it, I was having to go over Dr. Bishop's, some of the untruthful things he said in it. And I have the H part. I have ADHD. I was originally just diagnosed as inattentive type, but I definitely have the H. And that manifests in me by having to walk around and to get up constantly from my desk. If that's every 20 minutes or so, that's not too much of a problem. It's practically good for you. But if I'm going through over triggering materials, it can be every couple minutes or even every minute. That's what was going on. I was reading the things he said about me. I'd get upset. I'd go outside. And by the way, that happened a few years ago, and I did end up in the emergency room. I went there myself and told them what was going on, and they were the nicest people in the world. They were appalled. These guys were so busy, they were just listening to what I was saying, talking to the nurse outside the room. They came in, wrote up a prescription for Adderall. I just said it will help manage the anger. They were appalled at what had happened to me, and it was no big deal getting that prescription. But now it's just horrible. So anyway, I'm going through this report, going back and forth, being untreated for ADHD now. That's more or less constant. And I walked back in. Unfortunately, it's almost disturbing some of my neighbors sometimes. I had to fix my screen door because it was slamming. I slipped coming back, ironically, again, by writing your general counsel. So smashed my head against the sharp edge of my desk in my face. Um, I thought I had split my ear completely open. I thought I had lost my ear at the time. There was blood. This cut happened to it. The inside of my mouth was cut. There was blood everywhere. I still have headaches as a result. They seem to be subsiding. I'll recover physically from this, but that's what ADHD is. That's what it looks like. That's how it links to medical. So yeah, this is affecting my physical health as well as my mental. And again, I don't know if I'll ever get ADHD treatment again. I'm going to work on it. I'm going to try to help myself as best I can. I'm going to try to help other people uh, who's also fallen out of the system if I can. And, mostly again, this message was, this video was made to correct errors you made, but I did want you to know about what's going on with my physical health as well. The rest of my physical health has actually improved since I lost my medical care, but now that I'm back in the theoretically back in the medical system, it's not going so well. Anyway, thank you for listening. I would appreciate corrections on those records, and I do hope you have a nice weekend. Thank you.